Hello, this is Rootstv exclusive. Today we bring you an in-depth report on Noma disease, a gangrenous condition that rapidly destroys facial tissues, particularly in young children. In a remarkable collaboration, the Noma Aid Nigerian Initiative, NANI, and German Hilfsverein Noma EV have joined forces with Ministry of Health to establish an 80-bed treatment center at the prestigious National Hospital, Abuja. We are privileged to have exclusive interview with Dr. Charles Ononuwu, the coordinator of the Noma Center, Abuja. During this conversation, we will explore the significance of this initiative, its profound impact on communities, and the hope it brings to those facing the harsh reality of Noma.
Okay, it is our major vision really is targeted at the Noma disease, and Noma disease is a rapidly progressing infection that affects the mouth and the face. I just want to use that layman, view really. Okay, it's a rapidly progressing gangrenous infection of the mouth and the face, and it usually affects children that are from 2 to 6 years old, and these children are usually children that are found in areas where there is severe malnutrition, where there is poor hygiene, and also where ignorance plays a major role. Number one, the load of the patients in Nigeria. Nigeria has a large population, and of course, with the large population we have, the load of patients we have, is almost larger than any other country in Africa. So that is the major motivation, and also to take care of these children, because the children that this disease affects are mainly children that are from a very poor background, and if they are going to do their surgeries and pay out of pocket, they can't afford it. And that is why we have come in to treat these children free of charge. Everything we are doing for them, right from the time we identify them, wherever they are coming from, to resuscitating and making sure they're ready for surgery, and the series of surgery that are done, they're completely free. If you are to tell them to pay for that, they will not be able to pay for that. So our motivation mainly is to put a smile again in the faces of these children. We found out that majorly, most of the cases come from the northern part of the country. Now we are also seeing them from the southern part of the country. Yeah. So one cannot categorize and say, okay, is this here? So wherever the predisposing factors I have said earlier on, wherever you have poverty, extreme malnutrition, ignorance, poor oral hygiene, and at times neglect, you find out that it comes to play. And I forgot earlier on, immunization is very key, very, very key, because where if these children are not immunized, now the tendency for them to have things like measles, come in play. And once they have measles now depress their immunity further, and then the bacterial infection comes up, and then they have Noma. Like I said, the minister commissioned this place less than 2 weeks ago, and by Monday last week, we had patients coming in from Kano, coming in from Taraba, coming in. Yeah, Zero Noma mobilized them. Right now in the world, we have over 14 to 17 patients in the world now, you know, and most of these patients, they came in malnourished. I think all of them were malnourished, and then some of them even came in with kwashiorkor, you know, but they're doing well now in the world. So for me, it's a good way to start because, you know, we started having patients barely 4 or 5 days after commissioning, you know, and we thank Zero Noma for doing that. Okay, well, probably I start from from abroad first. Yeah, from abroad. Nani is supported solely by Hillsaction Noma, which is also supported by little personal donations from the people of Germany and Austria. Okay, and it's their personal little donations that, you know, so it's not from the government of Germany or government of Austria, but, you know, they also have been supportive in this. And yeah, that's Hillsaction Noma, Germany. And then in Nigeria, we have like I told you, Zero Noma. We have Nigerian Health Watch. You know, they're doing a lot of advocacy for us. They're out there, you know, putting it in the face of people, social media, and all that. And also, then we also have Ministry of Health. We cannot run away from Ministry of Health, because Ministry of Health is the major father of everybody here, and they're also doing quite a lot. So we're working together closely. WHO, we're also doing a lot with WHO. And then, of course, I can't forget National Hospital here that hosts. Yes, National Hospital had done tremendously, greatly to, you know, have us here. And we collaborate, you know, in quite a lot of things. With Zero Noma, right? We, like I said, the minister commissioned this place less than 2 weeks ago, and by Monday last week, we had patients coming in from Kano, coming in from Taraba, coming in. Yeah, Zero Noma mobilized them. Right now in the world, we have over 14 to 17 patients in the world now, you know, and most of these patients, they came in malnourished. I think all of them were malnourished, and then some of them even came in with kwashiorkor, you know, but they're doing well now in the world. So for me, it's a good way to start because, you know, we started having patients barely 4 or 5 days after commissioning, you know, and we thank Zero Noma for doing that. Also, Nigerian Health Watch is also doing their own bits, you know, in making sure that we have these patients here.